Chantal Ashrafan.
Mayor, on September 19, 2017, the results of a 12-year National Institute of Health study on the prenatal impact of fluoride on IQ was published in the prestigious Environmental Health Perspectives. To the consternation of fluoridationists everywhere, researchers found a significant reduction in IQ in children based on the maternal dose of fluoride. The dose-response trend documented that typical doses consumed by pregnant Americans living in optimally fluoridated communities could predict lower child IQs by up to 6%. This U.S.-funded study validated hundreds of prior studies with the same findings. However, in typical research fashion, it concluded with more study is needed. Think about this. The first government-sponsored American safety study in about 60 years validates independent research by finding an adverse effect on the brains of children exposed prenatally to fluoride, and the official response is more study is needed. Further human experimentation with fluoride is unjustified under the 1974 National Research Act. Modern reviews confirm there's no benefit from swallowing fluoride. Any benefit is topical. To continue fluoridation with the predicted outcome from prenatal exposure is a drop in IQ and/or hyperactivity disorder is unconscionable. I suggest continuation of a fluoridation program is more equivalent of the Tuskegee syphilis experiment. The Centers for Disease Control lied to patients in the Tuskegee experiment for decades, and they received endorsements from the American Medical Association and the National Medical Association. Sandy Grayson publicly said no one was interested when she asked why the Quality of Life and Environment Committees has not had any meetings about the dangers of fluoridation. How many pregnant women drank and used the deliberately elevated fluoridated Dallas water since January 28, 2015? Quite a few, especially in poverty areas. Mayor Pro Tem Caraway, please pay attention. The Dallas City Council cannot rest on 50-year-old CDC slogan any longer. 9 on this council can vote to halt the Dallas fluoridation program. Fluoridation is not safe and effective. Trusting in the consensus of agencies is not science. As an elected official, you have the authority and responsibility to protect your constituency. Dallas raw water already has fluoride, and you do not need to add more. Thank you.
Thank you.
Your next speaker.